What's up guys, Dr. Joe here, and today we are going to talk about lumbar bulging discs. So first of all, the bulging disc in the low back is something very, very common which I see on a regular basis. And fortunately it is something that can be corrected and be improved without having to use surgery. Unfortunately, many people do go to surgery for bulging and herniated discs, and they can be fixed naturally if you address the cause and if you do the right treatment. So first of all, what exactly is a bulging disc? When you have two vertebrae, between the two vertebrae, you're going to find a disc. And with that disc and the two vertebrae, there's a space that's created. With this space, there's a nerve that exits. Now, if these vertebrae are functioning properly, there tends to be no problems here with the disc. However, if these vertebrae stop functioning properly over time, then and the person bends, twists under load with a poor movement pattern, what can happen is the disc at this point will actually bulge, as you can see here in the video, or it will even herniate where that material relocates from the center to the outside and now starts to directly pinch the nerve. This is where you'll then start to get numbness and tingling down your legs. Sometimes you'll get weakness. Now, initially, these problems occur from a trauma. However, normally the precursor to these problems is that these vertebrae have not been functioning correctly for a long period of time. So the health of this disc tissue is solely reliant on movement from the vertebra. We call it imbibition, and what that basically means is that the material of the disc is being mobilized, worked, and moved, and pumped. The fluid is being pumped around the disc, which keeps it healthy. Whereas if we get a loss of imbibition, what happens is these vertebrae get stuck, they get locked up, they get misaligned, and the fluid no longer is pumped around the disc, and consequently with a bend, with a twist, with a load incorrectly, the material of the disc can then be damaged. And in becoming damaged, the material inside the disc then herniates and starts to pressurize the nerve on the outside. You have to think of the disc tissue a little bit like a jelly donut. So on the inside of the disc is the jelly, and on the outside of the disc is the donut. And what happens in a herniation, the outside material, as you can see here, tears, and what happens is the inner material, the jelly material, then herniates or bulges through this outside material. So what do we actually do to fix this? I think the first thing to be aware of is management of inflammation, because with disc injuries, the person will struggle with immense pain in their low back and often severe leg pain as well. And because there's so much inflammation in the low back, this is why people are struggling with the pain. So the first thing is to manage and deal with the inflammation. And what's really critical with disc injuries is that you do not put heat on the area, because if you put more heat on a bulging disc or on a herniated disc, then what happens is heat brings more blood to the area. Here you have a bulging disc in a confined space. So if you bring more blood to the area, you're actually going to make the problem worse. What we want to do here is put cold on the area, because cold reduces inflammation, takes down swelling. It's kind of like if you sprained your ankle and your ankle had swollen, you wouldn't put heat on that, you would put cold on that area. And this is exactly what we want to do with a bulging disc or a herniated disc in the low back. What you must not do is have hot baths, because you'll find while you're in the bath, it feels better because the muscles relax with heat. But as soon as you go to stand up after that bath, you're going to struggle. So rule number one is to always put ice, to put cold on the low back, on the area of the bulging disc directly, 20 minutes, 3 applications a day. The next thing to do is to actually address the dysfunction of the vertebra. And this is where you'll go to a chiropractor, to a specifically trained, qualified chiropractor who's going to adjust these vertebrae to get them moving again. And consequently, once these vertebrae are moving properly, the disc material can then recover itself. The final really important thing to do for disc bulges is to search or seek out non-surgical spinal decompression therapy. And what that does, if there is compression to this disc and there is bulging to the disc, what the decompression therapy does is it opens up the spine. It decompresses the spine. And consequently, when it does that, when we decompress this spine and we go this way, it sucks the material back in and allows the tissue to heal itself naturally. So 3 things: lots of ice, find a chiropractor who can adjust you specifically, and then finally, non-surgical spinal decompression therapy. The final thing to consider is that if you're struggling with a disc bulge, it's always important to know at what level you're struggling with. So to find a professional who can thoroughly examine you, and this would be a chiropractor, an orthopedic doctor, or someone who can take x-rays or MRIs so they can actually see more detail about your spine, and then consequently you can get the right treatment therapy. So disc bulges, they're not ideal, they're not great, they do hurt, but you can fix them naturally if you do the right thing. Dr. Joe signing out.